In the fall of 1918, the predecessor of our organization, known as Central Maine General Hospital, sent a team of 10 nurses to Fort Devens in Massachusetts to cope with a massive influenza outbreak among soldiers, the virus that would soon be known as the Spanish flu. While the flu would soon march north and east throughout New England, Central Maine from the western mountains to the mid-coast was less affected than areas to our south, chiefly Portland, and our north. But in the tenements of the mill workers, in the grange halls of our agricultural towns, and in the packed churches of Lewiston and Auburn, disease still had a chance to spread, and it did. A battle royale was launched among Lewiston's Board of Health, textile mill owners, and church leaders over proposed shutdowns. Any of this sound familiar? 102 years later, and in the face of another deadly outbreak, Central Maine Healthcare sent a number of our finest to the front lines of the COVID fight. We've worked hard to keep our communities safe against the backdrop of economic and political arguments for and against shutdowns. I'm recounting this particular set of events because it's Hospital Week, a time each year that we recognize and celebrate the essential work of our hospitals and their largely unsung heroes. This year we've delayed our big celebration of Hospital Week until the fall, but I wanted to make sure that you, our team members, know that your hard work is seen and appreciated every day. One particular notable aspect I'd like to call out today is your resiliency and innovative spirit in the face of adversity. The COVID crisis proved that in multiple ways. Take telehealth, for example. With patients reluctant to visit clinics for needed care, our CMH team stepped up to create a telehealth solution in rapid time, and boy did it work. Hundreds and hundreds of telehealth visits later, actually over 12,000 alone in the month of April, we've proven that we can adapt and overcome, all to the benefit of our patients. We did not see that coming. In fact, all the data we had convinced us that telehealth would not be very well received by the community. Happy to prove that wrong. The Maine urgent care team pioneered virtual health visits for those patients who really needed to be seen for everyday illnesses and mishaps, and now we can do so from the comfort of home. And talk about resiliency. At our long-term care facilities, staff and leadership acted very early to restrict visitors, screen everyone at entry, and put other safety measures in place. They worked hard to make this transition as easy as possible for their residents, who usually enjoy a high level of support and interaction with family and community. It has been a challenging time, but Bolster Heights and the Rumford Community Home have shown great resiliency. At each of our hospitals, team members created testing site solutions, emergency department protocols, staff redeployments, and unit changeovers in rapid time that have worked exceptionally well. Now they're successfully realigning to accommodate as we rapidly welcome patients back for procedures and surgeries that were postponed over these last several months. So let's take a moment, if not a whole week, right now to celebrate all of your hard work, innovative ideas, creative solutions, and resiliency. For more than 100 years, we've been caring for our communities in good times and difficult moments. Your work makes it possible for us not only to bounce back now in 2020, it supports our promise to keep providing care well into the next century. Thank you for all that you do. And remember, we are resilient. We are innovative. We are Central Maine Healthcare. Happy Hospital Week.